My name's Jet Liu. I'm one of the orthopedic surgeons at Washington Hospital, specializing in foot and ankle surgery. As you know, orthopedic is a specialty in medicine that take care of musculoskeletal issues, such as pathology with the bone, with the soft tissue, such as tendon, ligaments, and so on. And usually orthopedics involve sometimes surgical, but also non-surgical options for treatment for these. So with foot and ankle, we see a lot of traumatic injuries. We see bony, soft tissue injuries. We also see a lot of degenerative conditions, such as arthritis in various portions of the foot and ankle. Between young and older patients, there is a difference in general regarding their conditions they present in the clinic. Often in younger patients, I see more of a acute type of presentation, whether it is a bony injury or a soft tissue injury. One of the most things I see in the younger population when they come in is a tendonitis, whether it is Achilles tendonitis or some other tendon or foot and ankle. Often they're the patients that has a style that they exercise more often on the weekends. A term that more commonly people are familiar with is weekend warrior. So they have a pretty acute increase in activities, and they are now allowed to allow themselves to completely recover, and they have a repeated cycle of going to have a lot of irritating factors for those tendons. For the older population, they present as more of a subacute or chronic condition. More likely is something that's been going on for a long time, and they've been kind of ignoring it and then progressively getting worse. And then we're seeing more arthritic conditions, whether it's from a overuse over time or from a kind of deformity perspective, where they kind of worn out certain area of the foot that's overused over time. So there is a difference. The most common conditions in foot and ankle injuries are such as ankle sprain, such as plantar fasciitis, such as achilles tendonitis. The first line approach is always some conservative treatments, and they could be a combination of different modalities. In terms of ankle sprain, if it's severe, a short period of immobilization or resting with either an ankle brace or a boot, then early therapy, rehabilitation to strengthen different areas in the ankle that was irritated or injured, and work on the balance, what we call proprioception. And that's very important in terms of retraining the feedback between the foot and the brain, so they can place their feet perfectly on the ground the next time they walk, to prevent further recurrence of the sprain. In terms of plantar fasciitis, again, the first treatment is always conservative or non-surgical in nature, and with that specifically, we want to relax plantar fascia. It is the fascia that lines in the bottom of the foot that gets worked every time we take a step. And so these patients usually have some chronic onset of vague pain in the bottom of their heel, and that gets worse over time. And we achieve the relaxation with some combination of orthotics, arch support, heel pad, stretching exercises to loosen or to relax that tight band of tissue, and progressively with therapy and progressively going back to their regular activities. With Achilles tendonitis, these can be both acute onset, like in younger population, or sometimes older population with chronic conditions. So we try some ways to relax it, whether through a heel wedge, some kind of immobilization, stretching, some kind of pain medication, anti-inflammatories, ice of that nature, to calm things down first, and then start rehabilitation with progressive strengthening and going back to your regular activities. There are great orthotics or great even over-the-counter tennis shoes. Okay, if you have foot and ankle issues, go get a pair of supportive tennis shoes. If they have true problems that cannot be fixed with just simple change in shoe wear, then obviously there is more specific treatment options for them. Our body is always in the phase of healing. Let's say if you take a hike in Mission Peak and it's a rough hike, a few hours, you come back, your foot is sore, something's achy. The right thing to do is probably give some time off to have it recover. Maybe look into whether your hiking boots are worn out. Maybe wear some more supportive shoes next time. If things don't get better, over time, then it's probably time to seek for a professional.